Well, all right. Thanks, Paul. We, excuse me, as Paul mentioned, we are in our seeing the finish line, but we are entering probably, what in my opinion, the most important aspect of this conference, and that is establishing a national cardiac arrest collaborative. So we've heard a lot over the past 2 days, and we are going to have opportunity to discuss the perceived value of that approach versus the lack of value of that approach, depending on what the consensus opinion is. And we are starting that process now. Now, before I jump into that, I want to recognize a group which has really added phenomenal value to our discussions. We have recognized our sponsors. We have recognized the National Academy of Medicine's Health and Medicine Division, which have been a driving force for this conference, as well as our conference planning committee, all of whom have invested huge amounts of time and effort to make this possible. A group which I think needs recognition are the survivors, the survivor families, and the lay rescuers who were responsible for successfully resuscitating the survivors. One of the things that is so true, at least in my experience, is that we don't get a chance to see survivors very often. I'm an emergency physician, and we do everything humanly possible for a successful resuscitation, and when that occurs, the patient leaves my department, and within days they're gone, they're discharged home, and we never see you. And when we do, in my opinion, it is so inspiring, because what I get to see is that each valuable survivor is not just a single life. It is the connectedness of that life, in my opinion. So when I see a survivor, their spouse, and their children, I realize that it is that survivor, and that the spouse has a husband, and the children have a father, and that we all have a friend. And that is tremendously inspiring. And very importantly, the experience that you have had is so valuable. The experience helps shape us in improving that chain of survival, and has made a huge difference in this conference the past 2 days in shaping our understanding of the IOM report recommendations and shaping our plans of action as we move forward. A tremendous contribution. Your stories are so powerful. So I can get up at a conference and talk for an hour and show you statistics and p-values and confidence intervals and odds ratios with beautiful color graphs with dashed lines, solid lines, and dashed and dotted lines all the way through. And an hour later, everyone in the audience is asleep, okay? But you can get up and share your story with us, and in 5 minutes, absolutely convince everybody in the audience that we ought to do the right thing and improve outcomes from cardiac arrest in a certain way. Lastly, and not least, is the recognition of how inspiring you are to us. There are times when I'm up at 3 o'clock in the morning writing a grant, wondering why I am doing this. And all I have to think about is the last survivor dinner, and it's very clear to me why we're all doing this. So, We need to recognize the survivors. We need to especially recognize the surviving families and the rescuers who helped successfully resuscitate them. Thank you for being here. You have made the conference such a valuable contribution to the conference. Thank you. Now, consistent with that, it is my pleasure to invite Dr. Kelly Sawyer to the podium to share her experience. Kelly is a cardiac arrest survivor and emergency physician. Kelly.